AM 1430 KRGI, 105.5 FM. Good morning. I'm Brian Gallagher, guest in studio. Teresa Anderson is here from Central District Health Department. Congratulations, splashed all across the front page of the paper. Nothing like having that budget talk out there for the public, is it?
No, and we're very glad to have the budget talks over for another year. But this has been, through the pandemic, very challenging for us to make ends meet.
And let's face it, this is something that is vital to our existence. And as we talked a little bit about that discussion, when you put it all together, you're talking about a budget increase that's only about that big, right?
Yeah, we're asking for our local providers for less than $30,000 total, and that's from our cities and our counties combined. Our total budget this year will be $5.6 million. So for us, $30,000 is significant, always significant to get that local support. And actually, it will help us fund a new program that we have, which is designed to reach out to individuals where they are to assist them with getting the help that they need, whether it's applying for Medicare, Medicaid, whether it's finding a provider, finding a vaccine. That's what we want to do now, because through the pandemic, what we've seen is that there are certain groups of people who just haven't had equal access, and that's what we're about.
So it is necessity, isn't a case of trying to organize a ski trip or get a new company helicopter or anything like that. So
no, and our pocketbook is no larger than it was. We still only have so much money. We're using it as quickly as we can bring it in to better influence the health of our population.
Health influence is something we're going to talk about more because we have a new concern to think about. Monkeypox. What in the world is that?
So monkeypox, as if it weren't enough to continue with COVID and the subvariants that continue to emerge, what we're seeing now is monkeypox, which is a distant relative of smallpox. And those of us who are old enough to remember smallpox from the old days, or at least hear stories about it, know that smallpox was very deadly. Monkeypox is not as life-threatening, not nearly as much, but it does result in painful blisters that, and the malaise, the fatigue that can take a person down for 2 to 4 weeks. We know it's highly contagious, and right now we don't have a vaccine available for everyone. So we're focusing on folks who are more at risk. People who have multiple sexual partners is one of the areas we're looking at right now. And what we want to do is identify those individuals. We have some vaccine that we can protect them so that it doesn't spread. What we're afraid of, and this is true, anybody can get monkeypox. We know that that's the case. We need to limit the spread as quickly as we can to reduce the impact and make monkeypox go away.
This is something that we all need to be aware of. As we've discovered the hard way through all of the things with COVID and its continuing variants that seem to pop up consistently, we have to make sure that we're doing everything we can, and by getting more people to do that, you reduce the risk of spreading.
That is exactly true. And what we're seeing, in fact, I was on a call this morning, they were talking about how monkeypox virus will mutate and will become something different that we can't control if we don't get on top of it as quickly as possible. So we want anyone who feels that they're at risk, or anyone who develops a weird pattern of blisters, and they can be anywhere on the body. A lot of times they're in the private area, but they can be anywhere. And we want people who develop these blisters, give us a call, and we'll talk you through it. We'll get you the resources you need, and we want to prevent the spread.
We talked about COVID and how the variants seem to be making a resurgence. This is something that we need to be aware of because we're not out of the woods yet.
We are not out of the woods, and school is starting, and we want everyone to be up to date on their vaccines. Nearly everyone is eligible for a booster, and what we say, if you have not had a COVID vaccine shot this year in 2022, you need to get one.
Piece of advice from Teresa Anderson from Central District Health Department. Always a pleasure. Keep us safe, okay?
Thank you, Brian.
Good morning from AM 1430 KRGI 105.5 FM.